We use it a lot. It really is meant to keep people out of hospital. I think if we frame it as that, I think people won't be disappointed. Some people might think that this is some magical pill that makes all their symptoms go away. I don't know about that. But I do know that for the highest of high risk and for those who are unvaccinated who are at high risk, there's good data demonstrating that it keeps people out of hospital and significantly reduces the risk of severe complications like hospitalization and death. Maybe it does something above and beyond that. That's still, a part of clinical trials. I think what's really interesting, though, is it's not currently clear what it does or what the true impact is with lower risk fully vaccinated individuals in terms of mitigating symptoms or mitigating the shedding of virus, preventing onward transmission. We're learning more about that, and there's certainly theoretical benefit that could be helpful. But currently, the real aim of this is to keep people out of hospital who are highest of high risk, and it seems to be working. Before people get sick, they should look into how they can access this medication, right? We know COVID's not going away. We know this wave is starting to abate right now, but there's going to be more waves in the future. It's a great idea to have a treatment plan in place so that if you need to pull the trigger and have access to the medication, you can. And that means knowing a pharmacy that prescribes, that has this available, having working out which clinician or which healthcare provider you're going to access to help prescribe this, looking at your past medical history and your drug interactions or potential drug interactions with this. You can do a lot of the heavy lifting ahead of time before you hopefully don't get sick, but in case you do get sick, people can be prepared. Pharmacists are experts in drug interactions. They're trained healthcare providers. They're excellent in navigating people's medications and past medical history. And I think we'd go a long way in lowering barriers to accessing this medication if pharmacists were able to prescribe this without the need of a physician or a nurse practitioner.